The rising number of horrific and deadly assaults against members of the Asian American community continue to grow. Mental health professionals are now sounding the alarm that the assaults could have long-lasting effects even if you haven't directly experienced them. ABC's Zohreen Shah spoke to experts and one woman who suffered a frightening confrontation.
With anti-Asian American hate crimes rising, health experts warn of a surge in another crisis, a mental health one.
The impact is lethal, it's consequential.
An advocacy group tracking reported aggression targeting Asian Americans says they've received nearly 3,800 hate reports this past year. Incidents like the kind New York City-based healthcare worker CRISANNA TANG experienced in August. While commuting to help patients battling COVID-19, she was spat on and verbally assaulted with virus-related slurs on a packed subway car.
He starts spitting all over me, on my arm, my hair, my back. And he starts yelling all these racial slurs about going back to China and how Chinese people are causing the virus. People were just kind of minding their own business and pretending it wasn't happening.
Tang says the man ran off, but the experience stayed with her.
I don't really take the subway as much now, and I'm always constantly looking around.
Dr. Michelle Reja says racist aggression can have a long-lasting mental health impact.
When groups experience racial trauma, they have increased anxiety, increased depression, increased PTSD, increased substance use, and increased suicide.
Recently, incidents surfacing almost daily. An elderly Asian American man robbed, assaulted, later dying in Oakland, California.
He's like, communist China?
Oh, isn't that where you're from?
And in New York City, this woman in a cab verbally assaulting a man on the street. And a man police identified as Robert Long has been arrested and charged with murder in the deaths of 8 people, including 6 Asian American women at 3 Atlanta spas Tuesday.
It's kind of a pattern now. I feel like I keep reading about it now every few days about an Asian American, getting assaulted or harassed.
Tang says she has suffered further mental health stress seeing incidents like hers.
Not just because of the risk of getting the virus, but also obviously being harassed and assaulted because of the discrimination that the community is facing.
Dr. Reja encourages anyone impacted to lean into their feelings.
Number 1, practice self-care. So turn off the television and connect with your friends and family. Number 2, be aware of any symptoms. So if you're not feeling like yourself, or if you have thoughts of harming somebody else, please seek help.
Zohreen Shah, ABC News, Los Angeles.
If you're struggling with thoughts of suicide or worried about a friend or loved one, help is available. Call the National Suicide Prevention Lifeline at 1-800-273-8255 or text TALK to 741-741 for free confidential emotional support 24 hours a day, 7 days a week. Even if it feels like it, you are not alone. The morning news will be right back.